Hi everyone, welcome to our AMC1 prep series. This is my first video lecture on YouTube and we will start from preparation from cardiology. So today we're diving into a crucial topic for your exam, cardiovascular disease risk assessment. This is a high-yield area for AMC multiple choice questions, and by the end of this video, you'll have the tools to tackle those questions with confidence. Let's jump in. So, what does the AMC expect you to know about CVD risk assessment? It's all about using the Framingham risk model to categorize a patient's risk. High, intermediate, low. This model is a cornerstone of Australian guidelines, but it can be tricky if you don't know the details. Let's break it down step by step. This is how Framingham model looks like, and they are categories in two groups, diabetic and non-diabetic, and then divided into smoker and non-smoker subsequently, that you can clearly see in charts. First up, who needs to be assessed and when? All adults aged 45 years and older without a known history of cardiovascular disease must be assessed every 2 years. But for Aboriginal and Torres Strait Islander peoples, this starts earlier at 35 years and older. These target groups are super important and often pop up in exam questions, so make sure you note them down. There are some specific screening tests, those recommended to evaluate cardiovascular risk at particular age. Blood pressure should be measured at least every 2 years in all the adults from age of 18. Fasting blood lipids should be measured every 5 years from the age of 45 years and 35 years. For Aboriginal and Torres Strait Islander peoples, diabetes every 3 years from 40 years, and for Aboriginal and Torres Strait Islander peoples from 18 years. For kidney disease in all the adult at high risk of developing cardiovascular problem should be screened every 1 to 2 years, ACR ratio and GFR. Now, here's where it gets practical. In the AMC exam, you'll get a scenario with patient data. Think age, blood pressure, cholesterol levels, smoking status, diabetes history, and so on. Your job is to use a Framingham chart to determine their risk. Let's try an example. Imagine a 68-year-old female with a blood pressure of 150/90, cholesterol of 6.2, and she's not diabetic or a smoker. They have given age, blood pressure, cholesterol value, and not diabetic or a smoker. This is what we need to know for risk assessment. You'd look at the Framingham chart. We will choose the chart with non-diabetic women, then the age 68. So we will choose box with the age range between 65 to 74 and blood pressure 150. So we will choose the higher number, that is 160. After that, we will find appropriate column for cholesterol level 6.2, and always remember to choose the higher one. So we will choose number 7, and you might find she lands in the red zone, which is high risk. You can check the red box down here, and the number is more than 30%. So D is the right answer for this question. It's straightforward once you get the hang of it, but missing that higher category rule is a common mistake, so watch out. Okay, let's make this interactive. Pause the video right now and think about a hypothetical patient, say a 60-year-old male with 140/90 blood pressure and cholesterol of 6. How would you assess their risk? Got an answer in mind? Awesome. The right answer is 10-15%. Now, here's a quick FAQ. Will the exam provide the Framingham charts? Yes, they will. You don't need to memorize the charts. Just know how to use them. Remember, the most important data is history of diabetes, smoking age, systolic blood pressure, and cholesterol. These are the main parameters needed for the risk assessment of the cardiovascular disease. This is all you need to ace CVD risk assessment questions on the AMC1 exam. Practice with past papers, and don't worry if you make mistakes now. That's how you learn. That's it for today's lesson on CVD risk assessment. If you found this helpful, give us a thumbs up, subscribe for more AMC prep content, and please share with your friends who are preparing for AMC1. Check out resources like the RACGP guidelines at racgp.org.au for extra study material. Link will be given below where you can go and check the Australian guidelines. See you in the next video. Stay sharp and good luck with your studies.